A report by the Institute of Medicine suggests the federal government should step in to help Americans control the amount of salt they get in foods. According to the report, voluntary efforts to get food manufacturers and restaurants to cut salt in their products have not worked. Americans still consume about twice the amount of salt recommended for good health. To learn more about the dangers of this, we turn to ABC News Chief Medical Editor, Dr. Tim Johnson.
Joining me is old and good friend, I'll say simply good friend, Dr. Keith Ayoub, who is Director of Nutrition Clinic at the Albert Einstein College of Medicine, also an Assistant Clinical Professor of Pediatrics there. He joins us today from our New York studio. Keith, welcome to the program again.
Thank you very much. Good to be here.
And obviously we're going to talk about salt because news about salt is everywhere. I'm going to ask you a point-blank question. Is salt as dangerous for the American population, for all of us who consume it, as a lot of people seem to think it is?
Well, actually, only about, believe it or not, only about 25% of the population is really salt sensitive. But that's, but that said, I'm kind of glad that the attention is being given to salt. However, it shouldn't be given to just salt. There's a lot of other things out there that are raising our blood pressure.
And you can't tell easily if you're in that 25%. There's no simple blood test to tell you, for example.
No, there really is no way to tell. You really just have to sort of, you have to, if you have high blood pressure, you certainly need to be aware of your salt content. But I'll tell you, there's a lot of pressure with the new report from the Institutes of Medicine on restaurants and food, manufacturers to really reduce the salt in many foods. And to that extent, I think it's a great idea. However, they've set the bar very, very low in terms of what they consider the new tolerable upper intake limit.
Just to give us a feel for this low bar, talk about what we normally consume and what they're aiming for.
Right. The average American is said to consume, by most surveys, about 3,600 milligrams of sodium per day. If you eat out a lot, it's going to be considerably higher than that. Now, the recommended level, according to the 2005 dietary guidelines, is only about 2,300 milligrams. So we're really not meeting that. Now, what the Institutes of Medicine have proposed is really reducing what they call the tolerable upper intake limit from 2,300 down to 1,500 milligrams. Now, as a practitioner who would be somebody responsible for teaching this to consumers, it makes my job very difficult because while we're not even reaching the 2,300 level, which would be very useful, I'm not sure we'd be able to very easily meet the 1,500 level.
But here's how the thinking goes, as you well know, that we don't pay attention ourselves to what we pour on. We don't read the labels, excuse me, on foods. Food manufacturers have not voluntarily gotten it down there, so the only thing left is government regulation.
Well, that is one side of it, although I have to say the biggest area for new product formulation is in low and reduced salt foods. So many manufacturers are really taking the ball there. I think they're trying to jump the gun ahead of regulation. Interestingly, also, there's one, and I won't mention the name, but one very large, well-known soup company that's been actually gradually reducing the sodium in their standard line of soups for about 10 years now, and they did it without anybody knowing about it. They just sort of did it gradually, and that's one of the keys for people really resensitizing their taste buds and accepting a lower sodium level in their diet. Do it gradually.
And given that that is key to ultimate success, my understanding of the IOM and other recommendations is that they do it slowly, maybe even over a 10-year period. Doesn't that sound reasonable?
That does sound reasonable, and actually people can do a lot themselves. If they take, for example, a lot of canned foods, canned beans, for example, you can reduce 40% of the sodium just by draining and rinsing them. So that automatically takes care of a lot of people's issues. Now, in terms of things like other aspects of their diet, processed foods are a huge source of added sodium in the diet. Most of our sodium is not coming from what we shake out on the table. So it's really processed foods. However, if people were eating enough fruits and vegetables, for example, and enough low-fat dairy, that would squeeze out a lot of those processed foods and also help us meet what we're supposed to be eating in the way of fruits and vegetables and low-fat dairy anyway. So I think a lot, and actually a diet like the DASH diet that is high in fruits, vegetables, and low-fat dairy has been shown to reduce hypertension. So I think there's a lot that we can still do without having to wait for government regulation.
Good way to put it. We all agree that at least for some people salt is a bad thing.
Yes.
And so we've got to work on it voluntarily, and if necessary we'll get a little push from the government someday. But as always, Keith, you put it in perspective in a good context, and we thank you very much for joining us today.
I thank you very much.